Understanding liposarcoma. Causes, signs, symptoms, and treatment. Liposarcoma is a rare type of cancer that arises in fat cells and can occur anywhere in the body but commonly affects the abdomen, thighs, and retroperitoneal area. It is one of the most common soft tissue sarcomas. Here's a comprehensive overview. Causes. 1. Genetic mutations. Chromosomal abnormalities. Liposarcoma is associated with specific genetic mutations and chromosomal abnormalities, such as the amplification of the NDM2 gene and the CDK4 gene in well-differentiated and dedifferentiated liposarcomas. Not inherited. Unlike some cancers, liposarcoma is not typically inherited. 2. Environmental factors. Radiation exposure. Previous radiation therapy for other cancers may increase the risk of developing liposarcoma. Chemical exposure. Some studies suggest a possible link between liposarcoma and exposure to certain chemicals, though evidence is not conclusive. 3. Risk factors. Age. Most common in adults between 50 and 65 years old. Gender. Slightly more common in males. Types of liposarcoma. 1. Well-differentiated liposarcoma. Most common type. Generally slow-growing and less likely to metastasize. 2. Dedifferentiated liposarcoma. Arises from well-differentiated liposarcoma. More aggressive and likely to spread. 3. Myxoid liposarcoma. Characterized by a gelatinous matrix. Can be more aggressive and has a unique chromosomal translocation. 4. Pleomorphic liposarcoma. Rare and highly aggressive, with a high potential for metastasis. 5. Round cell liposarcoma. A subtype of myxoid liposarcoma. More aggressive. Signs and symptoms. 1. Painless lump. A common initial symptom is a painless, enlarging lump or mass, which can be soft or firm to the touch. 2. Abdominal symptoms. When liposarcoma occurs in the retroperitoneum or abdomen, it may cause abdominal pain, fullness, or constipation. 3. Weight loss. Unexplained weight loss may occur, especially in advanced cases. 4. Nerve compression symptoms. Tumors near nerves can cause pain, numbness, or weakness in the affected area. 5. Swelling or distension in the affected area due to tumor growth. 6. Functional impairment. Difficulty in movement or function depending on the tumor location, such as the limb or organ involvement. Diagnosis. 1. Physical examination. Assessment of the mass and evaluation of symptoms. 2. Imaging tests. MRI. Preferred for detailed images of soft tissues and assessing the extent of the tumor. CT scan. Useful for visualizing tumors in the abdomen or retroperitoneum. PET scan. To evaluate the metabolic activity and potential spread of the cancer. 3. Biopsy. Essential for confirming the diagnosis by analyzing the tumor tissue and identifying the specific type of liposarcoma. 4. Molecular testing. To detect genetic abnormalities and guide treatment. Treatment. 1. Surgery. Primary treatment. Surgical removal of the tumor with clear margins is the mainstay treatment. Complete resection is crucial to reduce recurrence. Limb-sparing surgery. Preferred for tumors in extremities, aiming to preserve function. 2. Radiation therapy, preoperative or postoperative, may be used to shrink the tumor before surgery or destroy residual cancer cells after surgery. Local control, particularly effective for reducing local recurrence. 3. Chemotherapy, systemic treatment, used for high-grade or metastatic liposarcomas. Common drugs include doxorubicin, ifosfamide, and trabectedin. Combination therapy, sometimes used in combination with other treatments for better outcomes. 4. Targeted therapy, molecular approaches. Research is ongoing into targeted therapies based on specific genetic alterations in liposarcoma. 5. Clinical trials, experimental treatments. Participation in clinical trials can provide access to new treatments and therapies. Prognosis depends on type and stage. Prognosis varies widely based on the type, size, location, and stage of the liposarcoma, as well as the patient's overall health. Survival rates. Well-differentiated liposarcomas have a better prognosis than pleomorphic or dedifferentiated types. Follow-up care. 1. Regular monitoring. Ongoing follow-up is essential to detect recurrences or metastasis early. 2. Rehabilitation. Physical therapy and rehabilitation may be necessary, especially for tumors affecting limbs or function.